Well, basically, it means that whatever we know of risk factors just came from population studies, not based on individual. We don't treat population, we treat an individual as a physician. So we need to know that individual's exact physiology and biology. So, yes, there are people who have a lot of risk factors and they live all the way in their 90s and 100. I've seen many in Texas where they smoke, they have high cholesterol, they live a long life. So that means that their body is somewhat not susceptible or sensitive to those risk factors. And then there are other people who have very low level of risk factors or none, and they develop events. Maybe they have other things that we don't know. So short answer is we don't know enough, but and we should not treat people as if we know enough. But at the end of the day, the most important thing is personalized medicine, meaning don't treat people based on population knowledge, treat them based on their actual anatomy, physiology, biology. So do measurement. Old days, we would do these calculation off of calculators, statistical calculators, because we didn't have technology then. We do have technology now. We should use them to identify disease in that individual and not rely on some mathematical calculators. Individualized assessment of biology by, obviously we do blood tests, imaging, coronary artery calcium score is very important. It's already been adopted now, increasingly adopted, and other molecular assessment, proteomic assessment, and genetic. You know, everybody should know their genes and should have awareness about their susceptibility genes. So a combination of those. Absolutely. I think 23andMe and alike, Helix, there are great, these are advantages of living in this era. So if you don't do it, you're not living really in our era. Just like if you are not using iPhone or Twitter or Google, you are not living in our era. We are in the era where we understand genes, so you would know. You should know about your genes. Now, we don't know exactly how they act and how they react to drugs, so we'll learn as time goes, but absolutely yes. Well, I think coronary calcium is much more precise because it just measures the pathology in coronary arteries, but genomic would be just a broad. But genomic, I think in future, babies, when they're born, they just get a quick blood draw and the entire genome will be sequenced and added to their database. So I don't think genomic would be, and it's much easier, you know, with a spit you can collect genome data. Coronary calcium you have to go get imaging, but in adult, for cardiovascular risk assessment, coronary calcium scoring and direct imaging of the heart is the method of choice.